Dr. Chant around? Oh, okay. Good morning, everybody. It's wonderful to be outdoors in Western Sydney to make some very important announcements today. Firstly, New South Wales, we've hit 82.2% of first doses, which is outstanding, and 52.7% of second doses. And of course, once we get to that 70% double dose number, we'll be able to enjoy all those things we've missed for far too long. Pleasingly, for 12 to 15-year-olds, we know that now 20% of 12 to 15-year-olds have had their first dose of the vaccine. Now, given that was only made available about a week ago, that is an outstanding result, and we're urging all parents to consider vaccinating their 12 to 15-year-olds. We want to make sure that when school goes back, not only do we have great coverage in the adult population of vaccination, but also in that 12 to 15-year-old group, which is so critical. Today, I also want to say that although we can't read too much into this, pleasingly New South Wales has 935 cases of community transmission, but unfortunately 4 people lost their lives, and we extend our deepest condolences to those to the families and loved ones of those 4 deceased. And I should note that even if case numbers go down, we should expect, unfortunately, that the number of people in intensive care and the number of people who lose their lives to go up, because as we've said consistently, because we've had a number of cases in the last few weeks, people ordinarily get very sick in the second week of the illness and sometimes stay very sick for a long time. And that's why we need to continue to brace ourselves for October being the worst month for the number of people who pass away and the number of people who need intensive care. And we should never lose sight of that, no matter what else is happening in terms of the vaccination rate or anything else. That is a likely scenario in October. So we can't be complacent, because we know that, unfortunately, given what Delta does, if we're too complacent too early, things can get out of control, and that's the last thing we want. We're all working together to get to that 70% double dose vaccination, and we should all keep working together and not take it easy, not be complacent, because we know what the consequences of that can be. Today I wanted to take the opportunity, as I'm joined by so many of our parliamentary colleagues, to say thank you to the Treasurer and Treasury for managing to obtain $11 billion for 49% sale of WestConnex. This is an outstanding result in very difficult circumstances, and will go towards supporting New South Wales recover and, of course, supporting our major infrastructure pipeline. And today I'm also pleased to announce, in the presence of all of my parliamentary and ministerial colleagues, that $5 billion of that will go towards a West Invest Fund to support local communities in Western Sydney in local infrastructure. And it's a very pleasing day all round. It also augurs well for our economic recovery, as well as our recovery coming out of lockdown. So New South Wales has been through a difficult time, and living with COVID and finding the right balance is always going to be a challenge. But we're definitely looking into the future with hope and optimism, and I know that many of my parliamentary colleagues right across the chamber will be so pleased with what this means for local communities and what this means for our future, given the difficult time that we've had. So Dr. Chant will now give the health update. Treasurer Berejiklian will give an update on the wonderful news today, as well as the new fund, and Minister Ayres, who's the Minister for Western Sydney, will say a few words, and then we'll take any of your questions. Thank you.
New South Wales recorded 935 locally acquired cases of COVID in the 24 hours to 8 p.m. last night. There was 1 overseas case. We had 124,650 COVID tests performed. New South Wales Health vaccinated over 23,156, but I'd like to really thank and acknowledge the key work of our GPs and our pharmacists, who have been doing an amazing job. As the Premier has indicated, we've got 20% of 12 to 15-year-olds already vaccinated, and there is increasing access to Moderna through pharmacies, which is appropriate for that age group, and also GPs have Pfizer as well. So I just can echo the Premier's call for 12 to 15-year-olds to please go forth and get vaccinated ahead of their return to school. There are currently 236 people in intensive care, 123 who require ventilation. Tragically, there were 4 deaths. A man in his 80s from Western Sydney died at Nepean Hospital. He was not vaccinated and had underlying health conditions, and his death is the second death linked to the outbreak at the Uniting Engleglaze Lodge residential aged care facility in Penrith. We have sadly the death of a woman in her 80s from Wollongong. She died at Wollongong Hospital. She had received 1 dose of the vaccine and had underlying health conditions. There was a gentleman in his 60s from southwestern Sydney who died at Liverpool Hospital. He was not vaccinated and also had underlying health conditions. We also had a gentleman in his 60s from southwestern Sydney who died at Liverpool Hospital. He also had received 1 dose of the vaccine and had underlying health conditions. So it does also call me to remind people that whilst 1 dose does afford some protection, it is critical that you come forward and get your 2nd dose in a timely manner. I want to announce that Cowra is going into a lockdown effective from 5 p.m. And anyone who was in Cowra from the 13th of September, regardless of where they are, must adhere to the stay-at-home requirements. There was a 9-year-old boy who attended school in Cowra and there were a number of associated community exposures. The source at the moment is under investigation, and I would call on the Cowra community, which I know they will respond to increased testing. And it is pleasing to see that the Cowra population has a high vaccination coverage, but again, call out the Cowra community to go forth and get vaccinated. We've also got some concerns around Dareton because of a sewage detection and also keeping vigilance in Kempsey. So again, if we could see those high rates of testing there. In terms of the suburbs, whilst we are seeing some pleasing declines in some of the suburbs, and clearly the numbers today reflect that, it is too soon for complacency. And so I call upon the communities of Greenacre, Guildford, Bankstown, Merrylands, Casula, Wayland, Fairfield, Maroubra, and the Wollongong and Central Coast communities, and the areas around Waterloo, Redfern and Inner City to please be vigilant for signs and symptoms. Come forward for testing and please take care as you go about your required activities under the public health orders. Thank you.
Thank you, Dr. Chant. Well, it's